Hi, I'm Alex Wieber. I'm going to be your student nurse today. I'm just going to perform hand hygiene. Can you tell me your name and date of birth, please? I'm going to check on your wristband. Thank you. I'm going to check your medical records to make sure your provider has ordered a catheter insertion. Alright, it seems we're all set to go. I'm going to put on the blanket first to cover you up whenever we have to lift up the drape, or the gown. And now I will lift your gown up and lift your legs, please. Thank you. And then I will apply my clean gloves. I'm going to palpate your bladder now to check for distension. Does this hurt or is it tender at all? No? Alright, good. Now I'm going to take out the catheter kit. Throw that in the trash. Then I'll grab this blue sheet by the outer 1-inch margin, and shiny side down, I will put it underneath the patient. And now, can you raise your hips for me? Thank you. Then I'll grab the white sheet by the outer 1-inch margin. And shiny side down, I will put it over like this. Now I'll remove my clean gloves and put on my sterile gloves. Alright, I will throw this away. Then I'll put the lube in the slot right here. Throw that out. I'll use the iodine sticks, unwrap them, go from top to bottom on one side, throw that stick away, get a new one, go down the other side, throw that stick away and go down the middle with a new one, then throw that one away. I will get my catheter bag out, unfold the bag, make sure the actual part that goes in stays sterile. And now to check and make sure the bubble works, I will insert a little bit of the fluid. Into the port. And as you can see, it's inflating. And now, with my non-dominant hand, I'll have to spread open her labia. I forgot. I have to lube this up first. Once I get about 3 to 5 inches of it in lube, I'll spread her labia open, find her urethra, and start slowly inserting it. And that should go all the way in. When it's done, until I'll keep pushing until I see urine. Then I'll push a little bit further. Then I would inflate the balloon, but I can't do that because it's the doll. Then I'd pull it out a little bit to make sure that the balloon's inflated and able to stay in place. I would have put this in her thigh holster. I would take off my sterile gloves. Put on another set of clean ones real quick. Then I perform perineal care to get the iodine off. I go from top to bottom with that flap. Get the new one. Go from top to bottom. Get this one and try to avoid the catheter but go through it to get the iodine off as much as you can. Throw that in the laundry. I would clip this to her bed and this to the bottom of her bed. This would be around here. I would put the gown, I'd move her legs back down. I'd put the gown back over and ask her if that's comfortable and if there's anything else I can get for her. Then I would document it in the MAR. I'd document how much fluid I inserted, which would be about 10 milliliters of saline. I would document how that was inserted correctly and the balloon inflated. And that would be it.